Welcome to this comprehensive guide on metformin, a widely used medication for type 2 diabetes. In this video, we'll delve into its uses, dosage, mechanism of action, side effects, use in pregnancy, and pharmacokinetics. What is metformin? Metformin is a biguanide, a class of medications that primarily lower blood sugar levels. It's considered the first-line treatment for type 2 diabetes, often used as monotherapy or in combination with other diabetes medications. Uses of metformin. The primary use of metformin is to treat type 2 diabetes, a chronic condition characterized by high blood sugar levels. Metformin primarily works by decreasing glucose production in the liver, enhancing glucose uptake by cells, and increasing insulin sensitivity. Apart from type 2 diabetes, metformin has also been shown to be effective in treating other conditions, including polycystic ovary syndrome, PCOS, a hormonal disorder affecting women. PCOS is associated with insulin resistance and can lead to infertility and other health problems. Metformin can help regulate menstrual cycles, improve fertility, and reduce the risk of developing type 2 diabetes. Gestational diabetes mellitus, or GDM. A type of diabetes that develops during pregnancy, GDM can pose risks to both mother and baby. Metformin is considered a safe and effective treatment for GDM, helping control blood sugar levels and reducing the risk of complications. Dosage of metformin is available in various tablet strengths, including 500 milligrams, 850 milligrams, and 1,000 milligrams. The starting dose is typically 500 milligrams twice daily, which can be gradually increased based on individual needs and blood sugar control. The maximum recommended daily dose of metformin is 2,550 milligrams. However, it's important to note that metformin is not suitable for everyone, and the appropriate dosage should be determined by a healthcare professional. Mechanism of action. Metformin's unique mechanism of action sets it apart from other diabetes medications. It primarily works by suppressing the production of glucose in the liver, a process called gluconeogenesis. Metformin also enhances insulin sensitivity, allowing cells to better utilize glucose from the bloodstream. This improved insulin sensitivity plays a crucial role in lowering blood sugar levels. Side effects of metformin. Metformin is generally well tolerated, but it can cause some side effects, including gastrointestinal issues. The most common side effects are nausea, vomiting, diarrhea, and abdominal discomfort. These side effects are usually mild and tend to subside with continued use. Lactic acidosis. A rare but serious side effect, lactic acidosis can occur when metformin builds up in the body. Symptoms include fatigue, muscle pain, shortness of breath, and abdominal pain. If you experience any of these symptoms, seek immediate medical attention. Vitamin B12 deficiency. Metformin can interfere with the absorption of vitamin B12, leading to a deficiency. Symptoms of vitamin B12 deficiency include fatigue, weakness, memory problems, and numbness or tingling in the hands and feet. It may also cause weight loss. It's important to note that these side effects are not experienced by everyone, and the benefits of metformin often outweigh the potential risks. Regular follow-ups with your healthcare provider are essential for monitoring side effects and ensuring the medication is working effectively. Use of metformin in pregnancy. Metformin is considered a safe and effective treatment for gestational diabetes mellitus, GDM. It does not cross the placenta in significant amounts and does not appear to pose risks to the developing fetus. In fact, metformin is preferred over insulin for GDM, as it does not cause weight gain and is associated with a lower risk of hypoglycemia, low blood sugar. Pharmacokinetics of metformin. Metformin is absorbed through the small intestine and reaches peak concentrations in the blood within 2-3 hours. It is not metabolized by the liver and is primarily excreted unchanged by the kidneys. The elimination half-life of metformin is about 6-8 hours, meaning it takes approximately 6-8 hours for half of the drug to be eliminated from the body. This is why metformin is typically taken twice daily to maintain consistent blood sugar control. If you found this video informative, don't forget to like, share, and subscribe. And as always, stay informed, stay healthy. Until next time. Next,